Hey everybody, Dr. Steve Hruby here from Kaizen Progressive Health. And if you're watching this video, you probably have problems with your wrist. And wrists are actually one of my favorite things to work with here at Kaizen Progressive Health. I am a chiropractor, and Kaizen, we work with an integrated medical team, so we have people on medical here as well too. And wrist injuries are something we see a lot of in this office. And one of the reasons we see such prevalence of wrist injuries in this office is because we get really, really good results. And I've actually saved so many people who were scheduled or were told that they need wrist surgery from that. So if you are potentially one of those people, it's been recommended to you that you're going to need carpal tunnel surgery or some type of wrist surgery down the road, I really invite you to come visit us. I can't guarantee you that you don't, but I can guarantee you if we can help and we feel like we can prevent that, we will tell you. If we don't, we're going to let you know, hey, that's probably your best option at this point. Let's talk a little bit about the different types of issues that we treat with the wrist. I mean, first of all, the wrist is actually a pretty complex joint. There's actually 8 little bones that make up your wrist. So there's a lot that goes on with the wrist, which is actually one of the reasons I love it, because it's kind of complex, and to me it's like a little puzzle, almost like a Rubik's Cube, to get the wrist biomechanics right. So it's one of my favorite things to work with in terms of issues that people come see us with. Now, a lot of what people come in with is what we simply call mechanical wrist pain. And that's because the mechanics of your wrist is creating issues. Often this has occurred because you've just overused the wrist. Sometimes there's just some type of repetitive use that you're doing. This is often the case with people who are on the computer a lot. We'll see mechanical wrist issues. But maybe you're playing a sport like tennis, golf, or just any type of use of your wrist over time. You can repetitively use it too much. It doesn't have to be a sport. You might be like cutting up things in your house a lot. Maybe you're making fruit or something like that. And those types of things can lead to mechanical wrist issues. So that's something that we will assess for and determine what's going to be the best course of action if that's what you have. Arthritis, osteoarthritis. This is often associated with people as they age, but many people who have arthritis in the wrist, actually when they were young, had a number of injuries in the wrist. They might have been skateboarders falling on their wrist. They might have been a football player, crammed their wrist up. They might have just been like me, a daredevil who's jumping out of trees and falling off his bike all the time. And that can lead to injuries that if the biomechanics when you're young aren't treated properly, then down the road, that's going to lead to arthritic changes. So if you're one of these people, we want to assess exactly where that's at, see where there is that we can stop the progression of that arthritis, and also what we can do for some pain relief and get the inflammation down. And we usually get very good results with osteoarthritis clients. Another issue that we will often see in the wrist is bursitis issues. All your major joints have burses in them. And they work as kind of shock absorbers to your joints, and they lubricate your joints. Well, if that bursa becomes inflamed, it creates what's called bursitis, and it is quite painful. You actually have a number of different bursas in your wrist because you have a number of different bones in your wrist. So that is something that we will often see with wrist issues. You might have a tendonitis issue, so the tendons in your wrist. There's lots of tendons associated with your wrist. All your tendons attached to all your individual fingers. There are tendons that flex all your individual fingers. There are tendons that extend all your individual fingers. And then you got your thumb that has other complex tendons involved with it. So there's a lot going on in this little bit of space. And inflammation there can often be causing a multitude of these problems all at once. And if you're having these problems for a long time, surgeons often like to tell you have a thing called carpal tunnel, and you may have carpal tunnel, and their solution to that is to alleviate that pressure more often than not through surgery. And there are certainly times where that is going to be somebody's best option because this has progressed and gotten so bad. But I will tell you more often than not, with my experience, is most people who have been diagnosed with carpal tunnel, we can help. Most people have been diagnosed with carpal tunnel and literally have been told that they're going to need surgery or, hey, it's just inevitable. We have saved so many people at least at this point, from going under the knife. And even if we can delay it for another 10 or 15 years, you always want to do surgery as your very last option. And listen, we're very thankful that surgery is there if you need it, but that should be by far your last option. And doing a conservative approach where we're actually rehabbing you and getting you back to where you were is always the better option that most people want to do. So if you're having wrist issues, please don't hesitate to give us a call. We will assess you. We're going to shoot you straight, whether it's something we feel we can help with or not. And we look forward to meeting you soon. Bye for now, and thank you for taking the time.